is your most priceless possession. Take care of it. There's no spare. This is the one you have. If you don't take care of it, if you want it to look a certain way, it's up to you. It's up to you if you want to look smaller, if you want to look brighter, if you want to, feel good about you. Just take care of yourself. And that actually just leads us to the very first conversation that we have this morning. It's time for, I think, advice circle. Is it health circle? What circle are we talking about today? Advice circle. And if we're going to be talking matters oral health, there's only one person who comes here every single time that we need to have that conversation, and that is Dr. Mwende. Karibu sana.
Thank you so much, Mikali. My name is Dr. Mwende. I'm a dentist by profession, and today we're going to talk about tooth decay in children and any other issues that you're actually supposed to look out for your growing child in terms of teeth. So just welcome.
Yeah, and when you've mentioned a few things on this show,
yes,
when it comes to matters children and their
yes,
oral health,
yes,
and every time you mention something, it just blows me away because I had no idea. First thing you ever mentioned was that a child in your womb can get fluorosis from the water that you drink as
yes,
a mom.
yes.
So it is a direct injection into the child's health.
Yes.
And you also mentioned how even after breastfeeding, we need to clean the mouth.
Yes.
And oral health for a child starts at a very young age.
Yes.
And we need to understand now why.
Yes.
Because that's where it starts. From when they're inside the womb to when they come here. Because most of the times tunangoja. Wakisha wakuwa kubwa hivyo wameanza kuwa na cavities tunawakimbiza kwa daktari.
Yes, yes. So the reason why we're talking about tooth decay in children is because, first of all, tooth decay has been known to be like the most common chronic condition in children. And the reason why we're actually taking care of these milk teeth is because we want your child to grow up well. Studies have actually shown that in children who have tooth decay, they are likely to have less weight and also less, in terms of development, their weight and height is likely to be lower compared to a child who has no dental caries. The other thing why we're actually looking at it is because a child who has actually started getting cavities when they are very young, they are likely also to get cavities in their permanent teeth. So if you compare that scenario, for a child who is, their teeth are just okay, they've actually learned to take care of your teeth from an early age. For a child with caries, that habit of just neglect is likely to go all the way to their adulthood. So we want them to actually know from a young age how to take care of their teeth. Also, in terms of psychology and self-esteem, children who actually have many cavities, you will notice that they are not very confident. So we want them to grow with a good smile. We want them to know that their teeth are actually supposed to look good.
Yeah.
So it's a matter of something that starts from a young age that actually translates to the adulthood.
And it's important that you mentioned this because it looks like just teeth, ni meno too, but it causes so many other things. It has such a huge ripple effect that comes to a point of even self-esteem.
Yes, yes, it does.
You will be wondering why this baby does not smile at all. It's because
Yes.
they notice their teeth is different from others.
Yes, exactly.
And they grow up like that, and we could have done something about it.
Yes,
so when
yes,
it
yes.
comes to taking care of children and their teeth, at what point do we start?
We actually start as early as birth. That one I think I've mentioned before.
Yes.
From the moment a child is born, the mother is supposed to keep cleaning the gum, because from the gum is where the teeth actually come out from. Eh? So you need to take care of the gum from as early as birth. And then once you start noticing the first two teeth that are actually coming out, you need to start now brushing. Just those two teeth. You get just a soft brush for the child and very little. It's like a smear of toothpaste. You just brush those two teeth. So from as early as that, that's how you're supposed to actually start taking care of the teeth. You can start visiting the dentist even as early as 6 months. Yeah, once you start noticing that the teeth are actually coming out, or once you start noticing just a change in the teeth. Maybe you're noticing that they are not coming out correctly, or you're starting to notice maybe some stains, or the child now is actually starting to complain about their teeth. So as early as 6 months, you can start bringing the child to the dentist. Another thing that you're actually emphasizing on taking care of milk teeth is because there are also cost implications. If these things are actually taken care of early, if you focus on the prevention rather than the treatment, so you realize that the cost for that really goes down. Because if you compare the rates for doing fillings and all that, they are quite high. And also for a child who is neglected for long, let's say for example, the milk teeth by the age of 3, they are all out. So let's take a scenario whereby the child has decay on those on those teeth.
Okay.
Do you know this child has not really matured enough to be comfortable with the dentist? So in such cases, you may find that this treatment is done under sedation or under anesthesia.
Which is expensive.
Which is expensive.
Yes.
So that is why we are trying to look at these things. And that's why we are trying to give information to the population and to the public that once you start taking care of your child's teeth, you're actually saving so much in terms of cost.
Okay.
Yes.
See, most of the times it will be your teeth issues will be related to sweet tea, especially if you're a child. Sweet tea, tamu tamu, sukari, and stuff like that.
Yes.
So what are some of the things we can do? And if that is true also, you can tell us. But what are some of the things we can do at home as a child is growing up, as a parent, to just make sure that we prevent anything coming in terms of, you know, oral health, ikienda vibaya.
Okay, so we usually look at, we can look at it this way, the causes first, so that we can know if this is the cause, then how are we going to prevent that. So for tooth decay, it takes time to develop. And you realize in children, it's more of, is the mom or is the guardian assisting the child in brushing. You know, when the child is below 3 years, they're not able to actually coordinate very well in terms of brushing. So at that age, you usually say you have to assist the child in brushing. You have to be there at the sink. You have to show the child, hold it like this. If they're not able to hold, you hold it for them. You actually do the brushing. The other thing that you're looking at is the issue of diet. What are you giving to your child? These sweets, you know, they snack a lot when they go to school,
Yes.
And then you as the parent, you don't know. So you have to tell your child, sweetie, no. Or for a child who can't like just completely avoid the sweets, they have to brush like immediately after.
Immediately after the sweets?
Yes.
They eat constantly.
Yes. Even the snacking, you know, kids snack a lot.
Yes.
The first thing to do with snacking is actually make sure they first take the main meal and then they can snack. Because if they snack before the main meal, they're not able to feed very well. Okay. So after snacking, let them brush. The other thing that you're actually looking at, caries, is about to do with the socioeconomic status.
Okay.
You realize that some parents are not even able to afford toothbrush, toothpaste, or they are not aware, or they are not able actually to access the dentist. So those are the things that you're looking at. Nowadays, now we're trying to bring the information that you can get even kale ka toothpaste kadogo, kale ka 20 bob, nunua hiyo. Buy for your child so that they're able actually to brush. The other issue that you're looking at is time. How long you actually give the food in the mouth to stay there. We've said if you're breastfeeding, make sure you wake up, clean the mouth after. If you're bottle feeding, don't make it very frequent. Even breastfeeding, it's not supposed to be frequent. It's supposed to be timely. Because if you make it very frequent...
But the baby cries.
If you make it frequent...
because they want
you can't keep on breastfeeding after every 30 minutes, 1 hour. No. Your child will start getting cavities. So you need to have a plan for your breastfeeding.
What?
Yes.
I'm just imagining how convenient, how easy, difficult it would be to keep brushing this child's teeth every single time. And it might be something that you need to teach them when they were young, while they're still young. So you do it for them, make sure they are doing it, so that they know, nikikula sweetie, ninakimbia nina brush meno.
Yes,
When
yes.
they're older enough, they start going to school and they're able to brush their teeth.
Yeah, so that's why we are saying have a plan for meals.
Okay.
You see, if you don't have a plan, you're likely to let the food stay in for long in the mouth.
Okay.
Especially foods that are rich in carbohydrates. Have a plan for the meals in such a way that once the child has taken their meal, they are able to take care of their teeth after. Because if the child is just feeding every now and then, every now and then, every now and then, there is no plan. And you realize that such children, their teeth are likely to get cavities. So, yeah, there should be a plan in terms of feeding. And that's why I'm saying even snacking, let them snack after the main meal. Because if you let them snack every now and then,
Yeah.
cavities.
I think some of us were protected by the Lord. I grew up in a duka. So sukari, unachota hivi, unalamba tu constantly.
But were you in town or in
town?
country?
In town.
What I came to realize is that actually in up country, children are less likely to get cavities as compared to town. Because in town, those things, those
There's
sweets,
so many things.
those many things, they are there. Yes.
But uko nyumbani. So we'll get to the issue of, we talked about socioeconomic and how it affects most households. The uko shago, kuna zile miti.
They work well.
Zinakatwa, zinaumwa.
Yes, yes.
And then you used them to clean the teeth. And you'd see your shosho ama your guka constantly.
Yeah.
Akonako
Akonayo,
kamuti.
yes.
Does it work?
It works. Imagine it works.
Does it need toothpaste, that one? Ama it
No.
comes in its own.
It doesn't need toothpaste. Actually, you can use it with salt. Just warm salty water, just to brush. But the thing is, it's like flossing. You know, with flossing, you don't need toothpaste.
Yes.
You just need to make sure that all the food is out. Trust me, it works better. The reason why we're having many people in town with cavities is because they're not actually able to access these free things. You know, utapata wapi mti town? Hakuna mti. So it works. It actually works.
Okay, because when we were young, ilikuanga tukienda ushago, shosho would make sure everybody has a kijiti kake as a kid. It was fun for us.
It was fun.
You'd even save yours, you andika initials zako so that nobody else uses it.
Yes.
So it actually works.
It works.
Oh my
it works
goodness.
better, yeah.
Okay, okay. Now we know. I don't know if you experienced that, but if you have any questions whatsoever when it comes to dental health, and today we're talking about tooth decay in children and also other issues around the same. Strictly children, and how it's not just the adults who need dental care. No, it starts immediately you give birth to that child. 111 that is our SMS line. Please send in your questions. We'll be getting into them when we come back. This is Full Circle with Mikali. Welcome back to Full Circle with Mikali. We have Dr. Mwende in the building. We are talking about tooth decay, oral health for children, and why we need to start early. So we have a couple of questions here for you. Lisa, is it okay to do fillings for children?
Yes, it's okay to do fillings for children.
Is there an age cap for that?
No.
Okay, please explain.
So the reason why we do fillings for this child is because we want them to be able to feed well, and also we want them the jaw to develop fully. You realize that if there is tooth loss early, the jaw may not be able to actually grow very well. So there is no age limit for what we call the molars in children, the back ones. We really take care of those ones because they are supposed to stay in the milk for longer, and also they hold the position for the permanent. So you realize if the tooth is removed early because of decay, before the time it's actually shaking, you realize that there is what we call space loss. If you remove it, the space between, now where that tooth was, it shrinks. So if it continues shrinking, the permanent tooth that was actually supposed to come to that gap,
Yes.
itatoka kando ama itakuwa locked inside because of the lack of space. So we actually need to do fillings for children so that we can take care of that. The other reason why we do fillings for children is just to improve on their appearance. Because sometimes if the child, for the front ones, the mom may not be happy with how they look like. And also the child, the reason we are talking about this is to improve on their self-esteem.
Yes.
So we do that to improve on their self-esteem and also to look good. Because I've told you these things, it goes even in school. Children might be bullied. Even they may not be able to express themselves fully because they feel like their teeth are actually not good looking. The other reason why we do fill the teeth is to prevent infections.
Okay.
If the tooth stays with that cavity for long, it can get infected. Most of the time, itakuwa kama kufura from the side. And we say that is usually pus. So we need to prevent infections in your child because when the child is young, when they're younger, the immune system may not be very good.
Very strong,
So we are trying as much as possible to prevent infections in your child.
From whatever
Because
angle.
trust me, if these infections are neglected and they spread, this thing can even lead to admissions. And that's why we're saying, you as a parent, you need to take care of your child's teeth so that you can cut on costs. Because this is something that you can actually prevent. So we do fillings for children. Ukipeleka mtoto kwa dentist na akwambie tunajaza meno. Stop fighting, because there are some parents who will like, daktari iyo meno ni milk tooth na inatoka. So there's no need to feel, they'll tell you.
Wait, so even the milk teeth will be filled?
Yes, that is what you're talking about.
Oh my goodness.
Yes.
I thought we're talking about like the older ones who've already gotten their permanent teeth. So even milk teeth will be filled.
Milk teeth will be filled.
And we'll lose that tooth eventually.
Yes,
But then we'll get a healthy tooth.
Yes.
And even in the meantime, when you're having a filled tooth, you're also feeling good about yourself.
Yes.
You're looking good. You're able to feed
good.
well.
Yes,
and
there's
you're
no
preventing
pain.
infection.
Yes, there's no pain. So we fill milk teeth.
Okay.
The last milk teeth to come out, they usually come out at the age of around 10.
Okay.
So you can imagine if that tooth that is coming out at the age of 10 is removed at the age of 3.
Oh.
What happens? The space goes, the child loses some teeth. We are trying to keep those teeth in the mouth for that duration so that they are able to shake on their own. The kind of fillings that we do, they usually allow the tooth to just develop normally. So it doesn't interfere with the development of the permanent teeth. So we want to keep that tooth for as long as possible in the mouth so that it can come out naturally.
Okay.
Because if you interfere with the natural process, you're interfering with the development and also the permanent teeth.
Can we have feeling on all teeth? There are teeth that can we have this teeth filled?
Normally, for the front teeth, we usually don't feel like, how do I explain it? For these, the front ones, huwa zinatoka mapema. By the time the child is like 5, 6, zinaanza kushake. So unless it's really bad, in a way that, some parents will tell you, I don't like the way these teeth look like.
Okay.
So daktari fill them.
Okay.
So we can go ahead and just do what we call cosmetic, just to improve the appearance of those teeth. For that just need.
Okay.
We usually don't fill them because they come out early. But in case there is need to fill them,
yes,
we do fill them. The other thing that we actually do, instead of filling them, is just to stop the progress of the decay. Yeah, we have what you call fluorides. We just apply on the teeth. If it's a small cavity, chances of it progressing like further, or rather the rate of progress of the decay is reduced. So instead of doing just the fillings, we just apply the fluoride.
Okay.
The teeth that we actually give priority in terms of fillings is za nyuma.
Ah, okay.
Yes,
Okay.
yes, yes.
I've always wondered what happens to these ones, Zaukumbele, but thank you for clearing that out. Let's talk about children who suckle their thumbs
Oh,
and what implication that has on their
okay.
teeth.
Thumb sucking is something we usually classify as a habit. So those are actually among the other things that you're actually supposed to check. Apart from decay, those are the other things that you're actually supposed to check as a parent. Is your child thumb sucking? Is your child having something we call tongue thrust? Tongue thrust is something that when they are swallowing, the tongue comes forward. Ni kama inaanza kutoka.
I'm trying. I'm trying to do it.
Those are some of the things that you have to check. We call them habits.
Okay.
The other one that is actually need to look out is biting of their nails. Do they bite nails? You need to check out, because those habits they change the formation, or rather they change the facial appearance of that child. Now with thumb sucking, because the jaw is still developing, now with that pressure, the child puts pressure on the palate,
Okay.
or rather the upper jaw. So you find that with time, the shape of the jaw will change to something either V-shaped, like inner.
Oh, because they suck
Yes,
like the
because
sauce.
the thumb has, once they are sucking, they are putting pressure on the upper jaw. So it changes the shape of the jaw. And then it also changes the shape of your lips.
Okay.
So if the lips were developed normally, now they change. Because at this age, the child is still developing. So things can change. So with that kind of pressure, now you realize that with time, the smile will change for that child, because the jaw has changed in shape. And then with also that, you end up getting what we call an open bite. So initially, if the teeth were
open bite.
Yes. Initially, if the teeth were contacting like this, now because of that pressure, zinaanza kuachana.
Okay.
Yes.
Okay.
So that is why parents, you should not encourage your child to thumb suck. It has a lot of effect. It has a lot, and if it's not managed early, now when the child is older, or at the age of 18, they'll tell you, I don't like the way I look.
Yeah.
You see?
And you let them do that.
Yes. So those are things that you need to check out for your child.
Okay.
Yes.
And what does the tongue thrust do?
The tongue thrust is now, when your child is breastfeeding,
Yes.
they usually have that, the tongue has to come forward so that they're sucking the milk. So you realize that once the teeth start coming out, that coming forward of the tongue, it stops. But for some children, it persists.
Okay.
Yes, so unaona ako around 5, 6, 7, 8. Na ulimi bado inakuja mbele. In a way that the teeth are actually opening up.
Miaka hivi.
Itatoka hivyo sana.
Oh.
But for some kids, you might actually notice, because you will also realize that their speech is not very good.
Okay.
Because the tongue is coming forward, and then you realize that their teeth are actually not contacting hapa mbele. For a normal occlusion, the teeth should like contact like this. Yes, like yours. So now with tongue thrust, you find that they have a gap because the tongue is coming forward. So that is one of the reasons why a child could have tongue thrust. The other issue is because maybe the tongue is a bit bigger than normal, and also maybe they have issues with adenoids.
How do you handle that then?
That one will be handled surgically. But if you notice that they have the tongue thrust, you need to visit the dentist, because the dentist can actually put treatment, appliances to stop that tongue thrust.
Really?
Yes, because if you neglect it and then they are older, and then they realize, my teeth don't meet mommy. What are we going to do? And now the treatment becomes again
very
way costly.
expensive.
Yes.
Okay. So we have a question here for you. Let me just get it. My baby is teething, but only the lower 2 teeth have erupted. Is this normal? Also, the gums are very swollen. Also, asking Daktari, is it normal to apply teething gel on my baby? This is Bet from Limuru.
Okay, I would.
I
Okay.
think they're 3 in 1.
When they're teething, I think that is at the age of around 6 months. So what happens when the tooth is coming out?
Yes.
The gum, it swells a little bit because the tooth is coming out, and then when it is coming out again, because of what you call plaque, hapo tu kwa yenye inatoka, you may find that the gum is a bit swollen. So we usually just put the child on just a painkiller to relieve the pain, and also the teething gel. It really works well. There's Bonjela for children. It works well. And also to prevent on that itchiness, you can give your child some crunchy foods. It's like massages their gum. Yeah.
It's like those toys that kids are given when they're
Yes,
teething.
yes, when they're
they're
teething.
silicone-ish or
Yes,
rubber-ish,
yes.
and then they'll just do this. So it's sort of
Yeah.
like massages.
Yeah, it just soothes the gum. It really helps a lot. So when the teeth are coming up, that inflammation is usually, it occurs mostly. It's normal. So you just need like a little painkiller and that teething gel.
There's something I've seen in children, especially with the teeth front. They're usually really big. First of all, they take forever to come out after the milk teeth after the milk teeth has been removed, and when they come out, they sort of have like jagged edges at the end.
Oh,
What is that?
that is normal. That is
Is
normal. That is normal. That is, we call them mamelons.
Mom, they have a name.
Yes. It's just they're, what do you call it? It's like developmental growths for kids. So zinatoka ni kama ziko hivi hapo juu, but then with age it wears out.
Okay.
Yeah, so it's just
It's normal. So let's not be scared.
Yeah, no, it's normal.
Okay, and I think I asked you this when we were on a break and you laughed at me, but it's a question. Why are some children born with teeth? Is it a curse? Should these teeth be removed?
So the reason why some children are born with teeth is because the milk teeth have just come out earlier. Yes.
How early is early? It can be early scary.
Yes, it's scary because this thing is actually cultural. In some communities, it's seen as a curse. It's not a curse because you find that if the child is born with these teeth at this age, the mom is likely to hide the child, ataki mtoto wake aonekane. Reason the community said that it's a curse, this is a sin. So what happens? The process of milk teeth formation, it starts during pregnancy.
Okay.
Yes, the what we call it's just basically when the tooth is forming, there's usually a lot of cell division, cell formation. So that starts very early during your pregnancy.
Okay.
So if the process is just a bit faster, the teeth will come out.
So
Mtoto atazaliwa nazo.
I laugh.
So most of the time, those two teeth are the milk teeth.
So we don't remove them. Or do we?
What I want to actually emphasize is that it's not a curse.
Okay. Yes.
Don't hide your child. Don't take that child to that traditional healer.
Mganga.
Zikatolewe. Your child is fine. We only remove them if they're loose, because sometimes ziko loose kabisa, and then the child might actually swallow them or aspirate. So we remove them if they're that loose. The other time when you remove them is if it's causing pain during the breastfeeding. Zina, mtoto anauma. Yeah. So you find that the breastfeeding has become a bit painful. That is when they are removed. Now, those teeth need to be removed in the hospital or in the dental clinic for two reasons. One, sterility. The instruments that are being used, they need to be very sterile, because your child's immune system at that age, it's almost like
non-existent.
It's not there.
Very weak.
So we don't want any bacteria being introduced into the mouth. So those instruments need to be very sterile. The other reason why we remove them from the hospital setting or in the dental clinic is because we need to monitor the bleeding. At that age, your child's blood, how do you explain it in simple words, like what we call the the clotting factors. You know, once you get a cut, after a few minutes, inafungana. For a child, that one is almost non-existent. The blood has not matured to that level, or rather the factors that cause that hazijakuwa formed. Call them vitamin K and all that. Hazijakuwa. So if this tooth is actually removed from the village, and that is not monitored, this child can have excessive bleeding even up to death. What? Recently, we had a story, I think, on Citizen TV. The child passed on from just the removal of those two teeth because the bleeding can be excessive.
Okay.
It can be excessive. So if you notice those two teeth, first of all, if they're okay and there's no issue in breastfeeding, don't remove. If they need to be removed because of mobility or breastfeeding issues, to the hospital. Usiende kwa waganga tafadhali.
Tafadhali. It's not a cast.
Yes.
So there's a question here. Someone is asking, can my baby have 6 erupted teeth from the lower gum and none on the upper side only for them to come out way later? Is that a cause for alarm to see a dentist?
Yes. You should see a dentist because normally there's a sequence. We usually have the lower and then the upper. Once you have the lower 2, the upper 2. The lower 2, the upper 2, like that. It's a sequence. So if you notice it's not just like one jaw, then there could be a problem with the upper jaw. Yes. So you need to go to the dentist. Most of the time you'll find it's because maybe the upper jaw, the gum, what you call the gum tissue is a bit more tough.
Okay.
In a way that the tooth is not able to pierce through.
Okay.
Or there could be something that is just preventing the teeth from coming up.
Okay.
So you need to go and see the dentist. Yes. It's normally a sequence. Okay.
Yeah. And thank you so much. You are also very helpful every time you come on the show. And our time is up, Dr. Ari.
Okay.
Let us know where your clinic is at and the social media, your number as well.
Okay, my number is 0765 000 006. I'm currently with Equity Afya, Roiro.
Okay.
Yes.
Asante sana.
Karibu sana.
We're going to take a very short commercial break. We will be right back. This is Full Circle with Mukali. Thank you, Mindy.